Well, welcome everyone this is our second Vaccine Fears Overturned by Facts webinar. Our one last week was focused on providers for an audience. This one is focused on parents and families as an audience. We are recording today. We will send out the recording and the slides to those who registered. So we want to remind everyone to stay on mute unless you're speaking. And we're going to try to do all question and answer through the chat just to be able to go through as many questions as possible. So we would encourage you to put your questions in the chat. You can drop those in chat anytime. Also, look, we'll be putting some resources and other links into chat. And then at the end, we'll have plenty of time for question and answer.
You've gone on to mute, Connie.
Sorry. So now, okay, I'm going to turn it over to Susan Wood, who's our IKC Education Awareness Team Chair. Susan is also a former chair of IKC, and she's going to tell you a little bit about our speakers today and about IKC.
Good morning, everyone, and thank you for making time in your day to join us. Today's discussion is hosted by Immunize Kansas Coalition, and you'll hear us refer to them, as Connie just did, as IKC. And our mission is to protect all Kansans from vaccine-preventable disease. And we share many resources on our website at immunizekansascoalition.org. So you'll hear more about that. Don't worry about scrambling to write that down. We'll be providing that again later. IKC is a nonprofit group, and we're composed of 49 member organizations, and we share our content with over 200 individuals on our listserv. I'm excited today to introduce you to two authors of this booklet called Vaccine Fears Overturned by Facts. And those speakers and authors are Heather Simpson and Lydia Green. Together, they run Back to the Vax and are on a mission to share their story with anyone that will listen. And what I find most appealing about this discussion today is it brings perspective that we don't typically hear about in webinar conversations, and that's the perspective of the parent or the guardian or just the person. So much is based on just evidence, science, providers, doc talk, nurses, and so this brings us really to the bottom line that says, why are you there and how did you get there? So Lydia Green is a married mother of 3 and formerly did not vaccinate her children. She's now a vaccination advocate and nursing student and hopes to counter hesitancy on the front lines. Heather Simpson is a former influencer, anti-vax mom who was popular in the anti-vax community as the mom who dressed as measles for Halloween. That was the least scary thing she could think of. Now, she tells her story about how her outlook on immunizations have changed and when it came to protecting her daughter. So I'm going to turn this over now to Heather.
All right. Hi, everyone. Thank you so much for having me. All right. So my name is Heather Simpson. I am a former anti-vaxxer. I tell people that I am the worst anti-vaxxer, or I was the worst anti-vaxxer that I had ever met. So just think of cliche. That was me. And then, yeah, the measles costume. And that was my sassy addition to it, you know, saying, I'm trying to think of the least scary thing I can dress as. So that was the measles. And that's coincidentally how I discovered Reddit. I called my brother and I was like, what is Reddit? I'm on the front page. And he's like, oh, no, get off the internet. This is your chance. Redeem yourself, please. So anyway, I have hopefully slowly redeemed myself since realizing I was wrong. But this is my daughter, Charlotte. She is 5. You can skip to the next slide. Or I can, I'm not sure. Okay. Just some of the stuff I shared back when I was the worst. I'm not vaccine hesitant. I'm quite certain I don't want them. I was very confident polio was not eradicated by vaccines. It was eradicated because it was renamed to something else. That's a big myth in the anti-vax community, that it was mosquito spray that was causing the polio symptoms. So yeah, that was kind of the stuff that I shared back then. You can skip to the next slide. Or yeah. Okay. So my story, I was not always anti-vax. I grew up getting vaccinated. My brothers and I all got our vaccines. We hated them, but we got them. Was not a big deal at all. So I was not raised in the crunchy community world. When I decided, or when me and my ex-husband decided to try for a baby, we stumbled across a 9-hour docu-series about vaccines, and it claimed to be middle ground. It was definitely not. It basically said if you avoid vaccines, you can avoid cancer, all sicknesses of any kind, like the common cold, autism, everything. And it was so convincing. By the time I was done with it, I was like, yeah, we are not coming anywhere near a vaccine. But there was a little bit of hesitancy in me that was like, what if I'm wrong? What if she were to catch a vaccine preventable disease, or he or she when I have kids? What if I'm wrong? And so I did end up having a daughter. And so it kind of, that's when I really started doubting the medical community. I noticed that she was breathing really weird one day, and she was wearing an owlet. It's a little sock that you buy over the counter, and it's not FDA approved, but I bought it, and it would monitor the oxygen and the heart rate. And it went off the first week that she was home. And so we took her to the ER, and they were just like, she's probably just periodic breathing. This is normal. Just wake up every couple hours, see if she turns purple, yada, yada. And I just fought for her for 2 months. Doctors ignored me. And it turned out she had like a very, very serious form of sleep apnea. And after that, I went to her follow-up appointment, and one of the doctors said, why did you use the outlet? It's not FDA approved. And I was like, but it saved her life. And they were like, yeah, but we need to follow the FDA. And it was like, at that moment, I was done trusting doctors. I was like, okay, I do not care about the CDC, the FDA, whatever. I'm going to do everything I can to keep my daughter safe. And so that was kind of the moment where I just was like, I am an anti-vaxxer, and I'm going to tell people about it. Connie, is this the, okay. I was just making sure this is the correct slide. Okay, it is. Yes.
Want me to go on to this one or go back to the other one?
Oh, no, it is correct. I was just getting confused for a second. Okay, so yeah, you can go on to the next one.
Okay.
So when COVID hit, I was kind of in like the influencer in the anti-vaccine world, and I started to see a lot of the anti-vaxxers being very anti-mask and very anti almost community. And I was thinking, I'm not going to get the COVID shot, but I could at least wear a mask, that might save a whole life. And I started speaking up slowly about wearing masks. That didn't seem invasive, but I kind of got pushed a little bit slowly out of the community. And then it just kind of started tumbling into, okay, what if these doctors and these people telling us this information really want to help us? What if I'm wrong? What if COVID is dangerous? It started spinning down this this path of science, and I started talking to more medical friends and learning more about it, and starting to realize these people actually want to save lives. Oh my gosh, I think I'm wrong about a lot of stuff. And that kind of snowballed into thinking about the measles shot and the tetanus shot. And it finally hit when my daughter got scratched by a feral cat, and I took her to the doctor, and I said, I am so tired of being stressed about tetanus. I wish there was a way to not be stressed about tetanus. And she was like, there is. Oh my gosh, Heather, really? There is. And so that was the moment where I was like, what? I'm going to trust that people are smarter than me and have our kids' best interests at heart. And that's when I decided to start vaccinating. So one of the biggest myths is that the COVID vaccine causes sudden adult death syndrome. This is so prevalent. I hear it all the time when an athlete suddenly passes out or anything like that, my anti-vaccine friends that I'm still friends with automatically blame the vaccine. And when anybody is diagnosed with, a heart arrhythmia, and it seems very prevalent with athletes, they say, well, it was because they got the booster a couple days before. So I went really deep into this, and that is just completely not true. And what I like to say is that vaccines happen at the same time as life. So life continues to happen at the same time as we are getting vaccinated, and sometimes coincidences do happen because of that. So the phrase sudden adult death syndrome was coined by anti-vaxxers to try and place the blame of these sudden deaths on vaccines. SADS does not stand for sudden adult death syndrome. It stands for sudden rhythmic death syndrome, which is caused by one of several genetic conditions that can disturb the heart's rhythm and can lead to sudden death in seemingly perfectly healthy young people. And I know that they've even talked about starting programs to screen athletes before it's too late, but this has been going on forever. Something that was going around on the internet is that anti-vaxxers are kind of acting like sudden death is a new thing in the world, but it's not. It's happened for forever. We are just kind of more aware of it right now with, heightened sensitivities of everything else going on in the news. And I love this. Okay, according to Dr. Michael J. Ackerman, the professor at the Mayo Clinic, or the Mayo Clinic College of Medicine and chair of the SADS Foundation Board of Directors, stated, there's not a single signal of increased LQTS events and CPAVT events. Both are two of the main genetic conditions that can cause sudden arrhythmic death syndrome among diagnosed and treated patients who've been vaccinated. They haven't seen a single rise in those markers, which is just so telling that this is just coincidence and life does just continue to happen at the same time as vaccines. So if John Doe was going to die of sudden arrhythmic death syndrome in June 2022, he was going to die of sudden arrhythmic death syndrome with or without the COVID-19 vaccine. You can move on to the next slide. This has been going on for years. The COVID vaccine causes infertility and miscarriage. I feel like this rumor has been happening since the beginning of the COVID vaccine. Like, this is the most prevalent rumor that I have heard out of any rumors, because I fell for it the first few months, and I was thinking, oh, I want to have more kids. I don't want to get vaccinated, and so I really, obsessively researched this because I was like, this cannot be real, and it's not real. So the reason this rumor ever even came about was because the COVID vaccine contains a spike, it's assumed to contain a spike protein called Synctin-1, which is vital for the formation of the human placenta. But researchers found that the vaccine doesn't even have the Synctin-1. It just has a spike protein that resembles Synctin-1. And I'm not sure that I'm even saying that correctly. I've said that like that for 2 years now, and I may have said it wrong for 2 years, so I am sorry. The conspiracies say that if the vaccine causes the body to form an immune response to Synctin-1, then the body will also attack the placenta. But like I just said, researchers found that it only has a spike protein that resembles Synctin-1. So furthermore, they found that genetically, the COVID vaccine spike protein is so dissimilar to Synctin-1 that it is only as similar as any other protein in the human body is to it. So no increase whatsoever. I mean, once you break it down, and that's the thing about science that I love, once you break down these vaccine fears to the very literal genetic level, all these fears just go away. All these rumors just go away, and they can be so hard science proven that you can't really get around it. So that answer really comforted me. You can move on to the next one. Okay, what can parents do? Okay, so if you are a new parent or you are questioning vaccines, what can you do? I would advise, above everything, avoid anti-vax Facebook pages and groups, and mute Facebook friends that post scary sounding vaccine disinformation. I still come across a lot of vaccine disinformation on my Facebook, and I have to go mute because it throws you off. You have to go through the source and figure out, okay, that's not the correct source, but you're just having your day and you're not, prepared for those false articles to just cross your path. So I would highly recommend avoiding crunchy sounding anti-vax groups and just trying to keep your newsfeed positive with true sources. Read books by pro-vaccine doctors. Dr. Paul Offit is a good place to start. I love his books because they're so real and honest, and he acknowledges that side effects can happen, and that when I read a doctor talking about the side effects that can happen, that gives me so much more trust, because he or she is acknowledging, okay, this is the percentage that could possibly happen. We're not living in denial, but this is the reality, and this is what you should expect. And that just, it gives me so much more trust in the medical community. So I recommend just reading as much as you can from pro-vaccine doctors. If you are terrified, ask to start slow. I'm a big proponent for this, because if I know a lot of doctors do not allow the slow schedule, but what I say is that if you push a patient away that wants to do a slower schedule, they're going to run to an anti-vaccine community, as opposed to, even if they go slow at 5 years old, they're fully vaccinated, and then they ran to the anti-vax community on the other hand, and they're not vaccinated at all. So what I say is that if you are freaking out, you can ask the doctor, hey, let's just do one shot this time. And odds are, and this happened to me, we did one shot the first time and nothing happened. So the next time I was like, let's just do more than one. Let's just do the schedule. Because that confidence was built up with me because nothing happened. I mean, it was just my anxiety. Ask your doctor to break down any specific questions you might have. For instance, can you explain why vaccines do not cause autism? I asked a doctor this once, and his answer blew me away, and just completely, just asking, okay, I know that the studies show that, but can you tell me why I can, like, on a scientific level, why do people believe it causes autism and why does it not? And when he broke that down for me, that was like, okay, that makes so much sense. Like, I can be nervous, but it's just not real. So yeah, I have another slide? Nope. Okay, well, that was it. Thank you, guys.
Thank you. Thanks so much. And yeah, good question and good answer there in the chat too. We're also posting some resources in the chat. Continue to post your questions as we move on to Lydia, and then we'll have Q&A at the end.
Hello, my name is Lydia Green, and I was a former anti-vax mom for over a decade. My daughter was 12 when I finally started to reconsider. Next slide, please. So she's now 15, and I was a pro-science person. I had a career at a pharmaceutical plant as a quality control chemist. I was very pro-science. I got my flu shot while pregnant with her. And it wasn't until she was born that I started to enter into this natural parenting community. And I think the hesitation started before even I got her first set of vaccines. For me, I have Crohn's disease, and I've had some negative experiences just having it for more than half of my life now, that may have colored my view of the medical profession. And when I had my daughter, I had a hard time breastfeeding her, and my doctor didn't really offer much support. He just said, just give her formula and don't be so brokenhearted if it doesn't work out. And I turned to a natural parenting group to get some answers so I could figure it out. And they helped me. I found such wonderful support there from other moms, and the advice they gave me worked. So this was how the trust started to build with these online communities. And so I took her for her 8-week appointment, and she was set to get 3 different vaccines. I remember being nervous and thinking, like, what if she has a reaction? Like, I can't remove this from her body once it's done. But my husband reassured me, and we went through with it. later that evening, she developed this long, protracted, high-pitched cry, and long sleeping jags, and just wouldn't feed very well. And after all our struggles, that also made me nervous. The following morning, after being up all night with her, I called public health, and the public health nurse, and at this point she's still crying and still not herself, and I'm starting to get, worried. The public health nurse brushed me off as a first-time mom, and I felt embarrassed, worried, and most of all, I didn't have an answer for why she was the way she was. And basically said, like, if I really believed, like, that really stuck with me, like the way she worded it, if I really believed it, I would take her to the ER. And I just didn't want to at that point because of how she addressed me. Like, what if they just say the same thing and no one's going to listen? By the next morning, she was back to her old self, but I had already gone to my online community, and what they told me about vaccination scared me completely. I was told, like, it was probably cryoencephalitis. You could see it in the insert. Here's the symptoms. This is DTaP cry. And I certainly wasn't going to vaccinate her with DTaP again. And I kind of explored an alternative schedule. But by the time she was 6 months old, I stopped vaccinating her completely. Next slide, please. I had 2 more kids. I didn't vaccinate them at all. They didn't receive a single vaccination. I questioned that sometimes, but I always fell back to inaction, especially with the more time that goes by and nothing bad happens as a result of your choice. You kind of feel more secure in that choice, but it doesn't necessarily mean it's the right choice. I was stuck in an echo chamber. So I have a post here of my time on mothering where I'm reconsidering vaccinating her if we ever plan to travel. But again, if you ask the same people if vaccines are bad, they're going to tell you the same answer. So I was never able to make that decision for my family. And then I realized as I was deconstructing this whole experience that I was trapped in what's called a triple filter bubble, which consists of my individual bias from my own experiences, my social groups, and my technological algorithms. Next slide, please. So my individual bias was that I have a chronic autoimmune disease. So naturally, it's easy to convince someone that a vaccine could mess up their immune disease or create that. In the booklet, I do discuss how vaccines are not a cause of autoimmune disease. I felt pressured into my C-section without being given the full picture of the risk versus benefit. So I felt let down there. I have some PTSD just having my illness and multiple surgeries. So I have anxiety regarding medical situations anyway. And I lacked support as a mother in my personal life by healthcare. And I just, again, with the breastfeeding story, I had poor support there as well. Next slide, please. My social groups started with online forums. Mothering.com was a natural and attachment parenting forum. I kind of developed the idea that if it's difficult, it must be the right way. So like by avoiding all of these products and quote unquote toxins and things, that I must be doing everything right, doing everything the hard way is the right way. And then the other platforms gained popularity. This was 2008 when I had my daughter, so Facebook wasn't that big yet, but over time it certainly got that way. Every facet of parenting is now a niche group. Breastfeeding, sleep training, there are people that are just, very insistent on both sides. Cloth diapering, strangely enough. Intactivism, which is people against circumcision, vaccinations, everything becomes its own tribe. In real life, I would meet people and I would ask them questions. I wouldn't flat out ask them if they vaccinated their kids, but it would start out with, do you use natural remedies? And I would see where that conversation would go. And I would find people in real life that also were hesitant or did not vaccinate their children. Next slide, please. So technological algorithms also don't help. It can seem like everyone agrees with you when in fact you are in a niche group and most people vaccinate their kids. Algorithms look at what you interact with and then bring you more content of that nature, and it becomes this cycle. It can seem like the whole world thinks the way you do, but it actually allows the few to congregate in large groups online. So it seems like you have a lot of support in your position. Some people call this the loud minority. Next slide, please. So I got out of my filter bubble because COVID drove me to seek answers about vaccination because I was unsure of what the state of healthcare would be. I didn't know if things would start kind of falling apart, the institutions that are designed to keep everything working in a society when people were, stockpiling toilet paper of all things, but other things as well. It made me nervous. And I started reconsidering, like, maybe if healthcare or sanitation collapses, I want my kids to be vaccinated for measles or diphtheria, because these diseases tend to come back without those things. My youngest was 2 at the time, and I always believed that the blood-brain barrier didn't develop until age 2 or 3. And I never actually looked into it beyond what I learned in these groups. And there's actually no data to support that babies' blood-brain barriers are not mature at birth. They are. So I had to sit back and realize that I was really wrong about that. And that is what triggered me to start searching outside of my echo chamber for other things I could be possibly wrong about. And I spent weeks and weeks dissecting each trope I believed. And every time I realized I was wrong. So I started using this tool because they talk about doing their own research, but that requires viewing information through a specific lens. This is the hierarchy of evidence. Anti-vaxxers tend to pick from the bottom or go to things that aren't evidence at all, like YouTube videos, anecdotes. Some of these disinformation dozen websites offer you a very curated information that oftentimes when they put a reference in it, the reference doesn't say what they're saying. So I started to use that as a lens. So if you are going to do your own research, this is a very good tool to use. Next slide, please. So fear pushed me in, but facts are what pushed me out. It was a very anxiety-driven reaction to what happened all those years ago. But it was the indisputable facts that allowed us to start vaccinating with confidence. I started analyzing, how did I believe this trope of the age 2 or 3 blood-brain barrier? There's zero evidence there, but that was the start of me starting to go outside that echo chamber. And we realized, like, the best thing to do is to explain these tropes to parents before they take on this belief system. So that's why we've worked together to create this booklet, so that when you're out there hearing this misinformation, you can go, well, that's not right. And we look at how those tropes scared us and how we were misled, so you can understand how we got to that conclusion. And I'm going to share 2 of my favorites, but there are many more in the booklet. So I talked about this at the last webinar, and I left it in there because there are now some very big influencers online talking about this myth again. It kind of went to the wayside, but it's being revived. This trope is just never going to go away. Wakefield did a great disservice to us all when he made this implication. My favorite study is a sibling study with 600,000 kids that included a completely unvaccinated group of a few thousand children. There was no protective effect. Avoiding vaccinations does not reduce your child's chance of becoming autistic. And that's because kids are born autistic. My first son was diagnosed with level 2 autism spectrum disorder. He started showing signs around 2.5. Didn't receive a vaccine until he was almost 5. So definitely for him, did not cause his autism. And after being vaccinated, his difficulties improved, not because vaccines do that, because correlation is not causation, but because evidence-based therapy works quite well for autism. He had a little brother born 3 years after him. And this was right around the time I was realizing I should vaccinate my kids. His little brother was vaccinated at the same age that he had his regression. There was no regression because he was not born autistic. And that's what the study showed. It has nothing to do with vaccines triggering it. It's you're born that way. And I can see now looking back that my first son has a different trajectory of development than his little brother. They are very different in their developmental arc. Next slide, please. The second thing that is big in these circles is the anecdotes that are shared, and that correlation is causation. So oftentimes people believe that vaccines cause their child's autism because around that age, developmentally, the signs will start appearing. But like Heather said earlier, life still happens after vaccination, and it doesn't protect against everything, just the disease that you're vaccinating for. So they'll use VAERS to scare people. VAERS is an unverified data collection service that there's no causation linked to anything. Oftentimes, there are multiple reports for the same adverse event. So it doesn't necessarily mean that that number of adverse events is the true number. They have to go through all that information and tease out what is an actual reaction to the vaccines and what just happened to be at the same time. So babies get vaccinated multiple times during infancy. And of course, some of those times are going to coincide with vaccinations, but studies show that the incidence of that is totally random. It doesn't increase 2 days after vaccination. It's random. And there's even studies that show a protective effect, not to say that vaccines magically prevent against SIDS, but parents who are bringing their kids to well child visits are gonna, get educated on things like safe sleep practices and how to lower the risk of SIDS. Another thing I like to say is if you give 1 million people a glass of water, some of them are going to get cancer, some are going to get a miscarriage, diabetes, or even die, but it wasn't the water, right? Like these things have a baseline rate that they occur, and sometimes they're going to occur after vaccination. That's what VAERS does to see if there's a signal above that baseline that is happening, and then we can attribute. This is how we were able to find such rare side effects, for instance, with the COVID vaccination. I like this one. Ice cream sales cause an increase in sunburn. So do we think ice cream causes sunburn? No. Hot, sunny weather makes people eat ice cream more, and now there's more sunburn. They have nothing to do with each other. So yeah, and as I said earlier, the VAERS data is analyzed. So we just look for those signals. Next slide, if there is one. Oh yeah, what helped me vaccinate was going through each of the tropes. I used Vaxopedia because they do a really good job with references. I spent a lot of time reading former anti-vax stories online. It was just helpful to know I wasn't alone. I had a nurse work with me. She just let me do what I wanted each visit and kept track of what was remaining. And the first time vaccinating my kids was probably the hardest because even though I knew logically it was going to be okay, I still had all of those fears that were kind of in my head for such a long time. But once I saw with my own eyes that they were okay, I realized quickly the worst part about vaccination is the poke. So I just wanted to get it over with in as few visits as possible, so we weren't having that horrible day too many times. And I always took them out for a treat after, but I just wanted to get it over with once I knew they were fine. Next slide. So parents can start with vetting their sources. We offer tips on how to spot pseudoscience, learn how to use that hierarchy of evidence. It can be hard. There's so much confusing information out there right now, but just know that there are people that genuinely care about children's health, and they'll point you in the right direction. Public health wants to see your child be healthy. They're not there to, cause a bunch of issues. It's not like that at all, but I know there's a lot of conspiracies out there that state the opposite. Ask the right people. Find a healthcare worker you trust. Build rapport with them. It could be your pediatrician or local public health office. They witness thousands of vaccinations. Make sure that they discuss these things with you. Make time for it. I suggest, if you're like me and was totally hesitant, make an appointment just for discussion, not for an actual vaccine, so you can get comfortable with who is giving you your child these vaccines, and they can reassure you. The other thing is, like, we have a lot of contrarianism in science right now, and that's good. We should have, conflicting opinions to figure out what the truth is. But if 9 out of 10 people are recommending something, and then you go see what that one person says, go back to those 9 people and say, hey, this person says this. What do you think of that? And they will explain it to you really well, like why that person is in fact not correct. I've made so many friends with scientists and doctors and researchers now, and they are so good at answering my questions for me. I really do feel confident in vaccinating my kids. And then work through your anxiety. There are many tools that help explain vaccinations to your child to help ease their anxiety. I always take my kids out for something fun after. And you have to remember that you're the adult. Kids don't know what's good for them. I mean, they don't want to eat their vegetables. They don't want to go to bed, but it's our job to keep them healthy in spite of what they think. So yeah, that's what I have to say about that. I think that's it.
Thank you so much for sharing your story. And I really agree with the sentiment that Cassidy posted, that, how wonderful that we're brave enough to look into these things, to change your mind. And now you are courageously sharing your story. Thank you so much for doing that, so that we can all learn from that. As I'm going to go through questions here in just a minute, but as I'm doing that, I'm wondering if you could share a little bit about how did your friends and family respond to, when you were anti-vaccine? Were they supportive? Did they agree or disagree? Like, how did your circles feel about that? And how do your friends and family and your circles of community, how do they feel when you changed your mind, and how do they feel about this now?
So for me, my husband was really relieved, because he was constantly having to defend my choices for me. His mom is a public health nurse who provided vaccinations for children at schools for many years. And so me not vaccinating was a huge bone of contention between us. And so they were relieved. My family has a natural distrust of the government because they're from a communist country. So they were very concerned with me vaccinating my children, especially for COVID. So that was kind of, I'm sure a lot of us know that COVID has, probably exacerbated a lot of relationship issues and made them worse. So I'm not alone in that. But for the most part, because I have a lot of first responders on my husband's side. They were all very happy to know that I was vaccinating my kids again.
For me, I lost a lot of friends when I went public as an anti-vaxxer. But at the same time, when I became pro-vaccine, a lot of those people that unfriended me decided to be against the COVID vaccine. So then they were upset that I was pro-COVID vaccine. It was such a weird shift. The people that had been so pro-vaccine for the childhood schedule that turned against the COVID vaccine. And so they were just, it was kind of even. I lost pretty much the same amount of friends when I was anti-vax as when I was pro-vaccine. I did lose all of my close best friends when I turned pro-vaccine pretty much overnight. But my family, they're very glad because my parents are very pro-vaccine. They were worried for my daughter's, health, like being exposed to diseases and things like that. So they're very, very relieved about that. So I've been, and then just the scientific community being welcomed in and the new friends that I've gained, that was my cat falling off of something, has been amazing as well.
Thank you. How did you both get connected with the various experts cited and referenced in the book? And how would you recommend to other parents who might be vaccine hesitant or vaccine skeptical reach out to experts they trust? And I can just say from IKC's perspective, we would, if you are a parent listening, we can connect you with experts. We have experts, physicians, nurses, researchers, people in Kansas, people that are nationally prominent. We would love to connect you. If you don't know where to go, we'd love to either answer those directly or connect you to experts.
And we have a group online that is private, and we vet the members with 5 experts that have varying backgrounds of expertise. So if that's a starting place for you where you can privately ask questions and get support for your anxiety, that's also an option. I've personally, I had a parent who was so afraid to call public health. She said, I know I'll go to that appointment, but I don't want them to be upset with me when I call, and I keep panicking. I said, would you like me to call public health, book the appointment, explain your situation, and then, you can just go? And she said, I would love that. So I actually called public health for her, explaining that she was very hesitant, that her kid had no vaccinations up until that point, and she was really needing some kindness and compassion to get through the first vaccination. So obviously I can't do that for everybody, but it is about, we do support each other through that anxiety. She did show up for that appointment and vaccinated her son, so it worked. But sometimes it's hard to make that first step. So having people who've been there can really give you that support you need to make those choices, and just know it's okay. We all talk about our first experience vaccinating our children, what that was like, side effects. And then when we do have side effects, which are normal, but we get nervous and we talk about them. And yeah, that happened to my kid too. They were fine, So yeah, it really is about supporting hesitant parents through their anxiety. And so if calling is a step too far right now, I do recommend our support group because we're awesome and we do support each other.
That's great. That's great. Yeah, Julia had a similar question. So you answered this in part. How can we help fellow parents overcome fears of vaccinations? But what about like at the beginning when you were headed down this path to vaccine skepticism and anti-vaccine? Is there a specific thing that a friend or family member could have said, or a resource they could have pointed to you that would have helped change your path?
I look back at my experience with my daughter, and it would have been so nice for that nurse to say, wow, you sound really scared. Do you want to bring your daughter in and we'll have a look at her? Like, bring her in. That would have been so nice. And I think that would have prevented a lot of the issues that happened as a result from the lack of support I had. So, I mean, we all know how new moms are. They're very afraid, right? They don't want to do anything that could hurt their child. We need to support moms more as a community, as a family. We're often just an island to ourselves, feeling so responsible for every little thing that could go wrong with our kids. And I think that's a huge issue. And I don't have an answer to how to solve that, but I do, as I go into public health, want to work in a more community-minded setting to have that connection and support again, because we are missing that.
One thing I noticed when I was in the anti-vaccine community, because I get asked this a lot, like, what does it feel like to have influenced people to not vaccinate? But when I was in the community, every single person that was in that community was already not vaccinating. So we just fed off of each other. There was nobody in my community that was pro-vaccine. It was like we all just friended each other, and just that echo chamber. So when I did have pro-vaccine friends that would unfriend me and things like that, it would have possibly helped a lot if somebody had reached out and just said, hey, like, this freaks me out too, but this is how I got through it, just like connected with me instead of making me the bad guy suddenly. I say, and I know I said this earlier, to, mute the misinformation on your timeline, but that doesn't mean cut off people that are wondering or having questions, because I know for me, I just wanted to keep my daughter alive. I was not trying to be this evil person. I wanted to keep kids alive. And I had a pro-vaccine friend, specifically, I have one in mind. She's a pro-vaccine nurse, reached out instead of blocking me right away and said, hey, I get this anxiety. Let's talk about it. That could have helped a little bit, but I was is the word villainized immediately, that it became political. It became right and wrong. It didn't become about the anxiety. And I was so scared to lose my daughter. Like, I had so many death scares already with her apnea and stuff. I was just so completely paralyzed in fear about vaccinating her. And I felt like I couldn't connect with anyone. So I felt like that could have helped slow it down, but it's hard to know.
I will say that healthcare is changing in how they're addressing hesitant people. They were so understanding when I was starting to vaccinate my kids here, and willing to do whatever I wanted, and just welcoming and warm. In the beginning, it wasn't like that. So when my daughter was much younger and I took her in with a fever to the ER, she had an ear infection, and the doctor looked at me and he was like, do you want her to die? And I just shut down, because of course I don't want my daughter to die. I'm bringing her into the ER. I'm just scared. And so that, for healthcare providers, they need to change how they approach. I will say that they are much more friendly and understanding than they were when I first started in the anti-vax movement. So good on them for realizing that they need to change. There's still a bit of a ways to go. It's not perfect, but I think there is a shift in how we address parents when they're afraid.
So there are a couple questions related to schools. I think James wanted to know if you thought the medical and scientific curriculums in schools or health curriculums should be strengthened. Emily asked, do you have any thoughts for how schools and childcare providers can promote vaccines? What's their role in supporting parents who may have vaccine questions and concerns?
Yes, that would be amazing. Having more education on even specifically vaccines in high school and things like that. That would be so cool to see.
Our booklet has a few ways on like how to spot pseudoscience. I think there should be a course, a mandatory course that everyone takes on how to spot pseudoscience, because they're very clever at marketing it. And it is marketing, because at the end of the day, those same people are selling products. So it is important to know it's a skill. It's not something everyone has, especially if you don't have any background in science. And in my case, even if you do. So yeah, there should be a course on how to critically evaluate information and spot pseudoscience. That would save a lot of heartache that we're now seeing today. Yeah, the education system definitely failed us there, and we were not ready for this pandemic at all.
There have been some data that shows that there's a stronger anti-vaccine movement in some rural areas. So James asked, do you all think in some part the anti-vaccine movement may be due to a lack of financial resources to be able to discuss concerns with doctors in a neutral, oh, sorry, I read that as rural, in a neutral setting and or time. So yeah, and then if you want to say anything about certain geographic areas or certain populations, do we need more resources just to be able to reach out to different populations? And then James's question, to be able to for them to have sufficient time to be able to discuss concerns with healthcare providers.
Yeah, I think my conversation with my pediatrician about vaccines was like 30 seconds, and that was it. Yeah, a lot of the moms in the anti-vax community when I was there, like involved in becoming friends with them and all that, they were lower income and a lot of single moms and just struggling and did not bring their kids to the doctor that much. So I mean, I definitely think there is a big component of that. And I have talked to a lot of doctors that say, we don't have the time. Like we have so many patients in a day. Like we can't just talk to people about vaccines. So there's something that needs to be done there. I mean, to me, that's a big part of it. I just don't know the answer.
And I think a lot of it has to do with messaging too. Like no one's going to knock on your door and say, guess what programs are in your area? Especially, if you're living in poverty. But there are programs in a lot of places, not everywhere is perfect, where if parents just knew about them, they may access them. But I think the issue is a lot of times they don't even know they exist. So I think a part of it has to do with messaging and welcoming and supporting and letting parents know. So when you have like a public health event where you're inviting parents, give them pamphlets of all the things in their area so that they know they exist to begin with. Like, here's a number you can call. I know where I live, there's a hotline where you can talk to an RN at any time and they'll answer questions about vaccination. So it's just a matter of people knowing that these things exist. And I think that that's where a lot of this gets lost, is that you can't access anything if you don't know it's there.
Oh, thank you. So what about parents or families? Is there anything they can do to encourage their providers to bridge gaps in understanding and build trust? Do you have any tips about how parents can more effectively advocate with their provider's office to make sure they get their questions answered and that their family's needs are met?
And when you call saying that, hey, I want this appointment to be all about talking about vaccines, just as a heads up, that's the best that I can think of, because if you go in for an ear infection or something like that, and then you tag it on at the end, I would make the appointment all about the vaccine topic and have your questions ready. And then the doctor, the provider is already in that mental state and ready to help you and to answer.
I've suggested before that doctors' offices have an email specifically for questions like that, because you don't exactly have a lot of time some of the time, but there are times, where you have 5-10 minutes to quickly look into a question. And so having an email like lets you do that at your own leisure, and as opposed to having to tag it on at the end of an appointment when a parent has a question. And it allows you to answer it more thoroughly as well.
Oh, sorry. My doctor let me text him afterwards, and I know that's not every provider, but he said if anything comes up with Charlotte at all, any side effects, text me. Let's talk about it. And because it was her first shot, he knew I was freaking out. But if you talk to your provider about like, hey, I am super scared right now. I am on the lookout for side effects. Who can I call at 2 a.m.? Who can I text? Who can I like, and just make it known that you need some kind of, usually they have someone on call, but just letting them know that this is what I need could help a lot.
Great. There's a question about social media content and the algorithm. And I'm not going to ask you about that specific act because I'm not familiar with that and you may not be either. However, you are on social media or have been on social media a lot. So, and Lydia, you talked about, that triple bias. So, what can you do as a parent or a family member to help people overcome that triple bias to get out of the social media echo chamber? And are there policies that we should advocate for to our social media providers and others to help us move away from this?
I think there needs to be accountability in several parts. Like, I think that doctors or healthcare professionals that abuse their title to spread disinformation on vaccination and other things should be held accountable. I think tech companies need to be held accountable. A lot of the stuff we're seeing now is because there is zero regulation on spreading disinformation, and this costs lives. So everyone goes on about free speech. Okay, great. I can't yell fire in a theater if no fire exists. And I think spreading disinformation is much of the same. I don't think it's speech that should be protected. If it's verifiably wrong and the majority of it is, it shouldn't be allowed. And that's my opinion. And maybe that's extreme. I don't know. So yeah, policy does need to change on various levels. I think it's Colorado that has a really good program where if you want a vaccine exemption, you need to take a course. And that course is actually wildly successful. I think 2/3 of the parents that take that course end up vaccinating their kids. So yeah, you want your exemption, great, but you have to have the full picture before you ask for that and know exactly the risk you're taking when you forego vaccination for your children. So yeah, there are a lot of different places that policy needs to change to get on top of this problem.
Yeah, I have to look up the 230 thing that he was talking about as section 230, but I had a meeting with Facebook last year because they were trying to tackle this information, and it really did come down to, I mean, policy needs to change because at the end of the day, ads target certain people and that makes money, and so they allow information that is not true on there. And like Lydia said, you can't yell fire in a theater, you can't yell bomb on an airplane, you can't, there is accountability there. And so that is kind of one of our controversial opinions, that there needs to be stricter guidelines on platforms like Twitter and Facebook and all those things, because lives really are at risk. So, and it's not, you don't own Facebook, it's not just going outside and saying something. It's an owned company. So yeah.
Thank you so much. So we're getting close to the end of our time. So I'm going to go ahead and wrap us up. But before I do that, I'm just going to see if Heather or Lydia, if there's a final word they'd like to share about anything, and then we'll share with you about a couple of resources, and we will make this recording and the slides available after today.
For me, if you're a parent that's listening right now, spend a few days, if you're vaccine hesitant or completely, spend a few days leaning into the idea you could be wrong. And it's uncomfortable. It will be very uncomfortable, but try your best to like leave that echo chamber you're in and just really explore one thing at a time, one big belief, if it's the blood-brain barrier, or if it's, you know, the aluminum thing, just really see what other people have to say about those myths that are perpetuated in the anti-vax groups, because there are people more than willing to sit down and explain. You know, Twitter's a bit of a hellscape right now because there's no moderation, but there still are many, you know, scientists and doctors and researchers that if you reach out and you're genuine in your concern and questions, they will take the time to explain why that trope is wrong. So that's my biggest thing, is just try to lean into the fact that you might be wrong, and it's okay.
Yeah, I second that. It's very uncomfortable, but it was one of the best things I've ever done. So, and it was not comfy, and it was a ride, but I'm glad that I did.
Thank you. Thank you again for being courageous enough to share your story with us and giving us tips on how we can be more supportive and more encouraging to parents who have questions, to parents who are skeptical, and to parents who are anti-vaccine. So for now, I would like to share a little bit. We do have with IKC, we do have a parents and family group. There's a parents and family interest survey, a Facebook group, and stay tuned because there are more things happening. So more parent and family groups at the community level that will be forming and are forming now. So we'll have more information about that soon. And of course, today's booklet that we talked about, you can learn more about the vaccine fears overturned by facts on IKC's website. The link is there. You can download the digital booklet. We also have a one-page key fact summary, and we'll have some more information on print copies soon. We have a few copies that we've printed and they're almost gone. So we'll have more information on that soon. Thank you again for joining us today. Please connect with us online and look for a recap of this webinar to come out soon, and we'll send that to everyone who registered. Have a good afternoon.